A new era of CKM care. In a bright, modern conference room filled with eager listeners, Dr. Yogesh Akani began his presentation with a spark of enthusiasm. Welcome, everyone. Today, we are stepping into a revolutionary concept in medical care, CKM syndrome. It's not just about treating the heart, the kidneys, or metabolism in isolation anymore. The American Heart Association has recognized that these organs are deeply interconnected, forming a unified framework for patient care. In 2023, we are not just treating symptoms, we are addressing a system. The destructive feedback loop. With the room captivated, Dr. Akani continued, "Let's talk about the destructive feedback loop that so many patients find themselves trapped in. Obesity, type 2 diabetes, and chronic kidney disease don't just coexist, they feed off each other, creating a cycle of multi-organ damage. If we don't treat this as a whole, we risk poor cardiovascular outcomes. It's crucial that we see the entirety of the problem." The growing burden. Dr. Nancy Akani, listening intently, chimed in with concern. "You're right, Yogesh. This isn't just a theoretical concern. CKM syndrome is becoming a global epidemic. Millions are affected, and here in India, the urgency is palpable. With our high rates of dyslipidemia and dysglycemia, we need to act swiftly and decisively." The Indian phenotype. "Exactly," Dr. Akani agreed, nodding. "Indians face a unique challenge. We encounter sarcopenic obesity, severe insulin resistance, and central fat accumulation. This leads to diabetes and cardiovascular diseases manifesting a decade earlier than in Western populations. Timely intervention is not just important, it's essential." Pathophysiology of CKM, 3 stages. Dr. Akani then explained. Let's break it down further. The pathophysiology of CKM can be understood in 3 stages. First, the initiator, metabolic dysfunction driven by insulin resistance. Next, the amplifier, chronic kidney disease that worsens the damage. And finally, the outcome, major cardiovascular events and often premature death. Addressing all 3 stages is critical for effective therapy. The kidney as an amplifier. Interesting, Dr. Nancy interjected. "It's fascinating how the kidney plays such a pivotal role." "Indeed," Dr. Akani affirmed, "the kidney isn't a passive organ. It actively drives disease progression. Chronic kidney disease accelerates inflammation, vascular calcification, and heart-kidney crosstalk, making patients far more susceptible to major adverse cardiovascular events." Why GLP-1 RAs are special. Dr. Akani's tone shifted to optimism. Now, let's discuss GLP-1 receptor agonists, particularly semaglutide. These medications target the entire CKM pathway. They improve insulin sensitivity, promote weight loss, and provide nephroprotective effects. They're tackling both the initiator and the amplifier in one fell swoop. Clinical evidence for semaglutide revealers. His enthusiasm grew as he shared the evidence. Large meta-analyses show that GLP-1 receptor agonists can reduce major adverse cardiovascular events by 14% and improve kidney outcomes by 21%. The pioneer trials demonstrated that oral semaglutide not only reduced HbA1c more effectively, but also led to greater weight loss, while maintaining proven cardiovascular safety. The evidence is compelling. Practical use in CKM patients. Dr. Nancy leaned forward with curiosity. "How do we implement this in clinical practice?" "Great question," Dr. Akani replied. "Our clinical focus must be on potent glucose lowering, significant weight loss, and cardiovascular protection. Semaglutide should be taken on an empty stomach with a little water and followed by a 30-minute wait before food or other medication. Yes, there can be side effects like nausea, but they are usually mild and temporary." Conclusion: a single tablet revolution. As the session drew to a close, Dr. Akani looked around the room, his eyes sparkling with hope. Oral semaglutide represents a game changer. A single tablet that can address diabetes, protect kidney health, and lower cardiovascular risk at the same time. I leave you with this thought. Could this innovation reshape the standard of CKM care for our patients? The room buzzed with excitement as the implications of this new approach sank in, marking the beginning of a hopeful new journey in CKM management. By Dr. Yogesh Akani.